and welcome to the Business Spotlight. I'm Pat Dewar, and I'm so excited to have you here today to introduce you to a good friend of mine and a chiropractor, Dr. Spencer Shanley, in the Keller area that I've been using, and I encourage you as well. Dr. Spencer Shanley, so tell me, how'd you get into this business?
Well, when I was younger, I was really interested in lifting weights, working out. I was an employee at a restaurant waiting tables. And I was also interested in physical therapy when I was younger. And I didn't know where I was going to go in the future. As a young boy, you have so many options. You don't know what you're going to do. And so as I was going around and I was following a physical therapist, I really liked that a lot. And I saw myself leaning more towards that instead of owning a business. And I came across chiropractic one day. The chiropractor said that he does physical therapy, he owns his own business, he works with people, and he does personal training and all the things that I wanted to do.
Right.
So that was an eye-opener for me. I said, this is perfect. I don't have to choose anymore. This is exactly what I need to be. I need to be a chiropractor. Not to mention, when I was 19, I was in a severe car wreck. And I didn't know about chiropractic at that time. And if I had, it's just something that was passed along, I didn't have the information of what they did. Years passed, and I woke up one morning and I had severe jaw pain. I couldn't move my mouth. My mom took me to the dentist because it was a jaw issue.
Sure, you'd think.
Yeah, and the dentist said that I was grinding my teeth while I was sleeping, that I would need a mouth guard for 3 or 4 months, and it might work. We didn't like the idea because it's $500. It might work, it might not. And so she decided to take me to a chiropractor. The chiropractor felt my neck and immediately told me it was my upper neck on the right side causing my jaw problem. The nerve in my neck was pinched and it was affecting my mouth. And that's why I was having that issue with not being able to open my mouth for 3 weeks. He immediately adjusted my neck, and within seconds, 50% of my severe pain was gone. And as a young person, you say, oh, it's 50% better, but it's still not perfect. It's still there, 50%. Looking back, that's amazing.
Right.
But it did make a difference, and within 12 hours, my jaw problem was gone. The pain was gone. I was able to use my mouth again. And I said, there's something to this chiropractic. So throughout my life, with all the interests of who I wanted to be, with my experience with being adjusted, it was definitely the path for me.
Excellent. That's really good. So when I think about the Keller area, you have your practice out in the Keller area, and typically this type of venue tells your story, but the people that are attracted to you are within the Dallas-Fort Worth area mostly, correct?
Correct.
And what are some of the, when I think about your industry, what's probably one of the most dramatic things you've seen in the way of improvements that you've been able to make?
Well, our number one success is decreasing migraines and headaches. So when people are suffering for years with headaches, they're taking Advil, Tylenol, of course, the things that even I take from time to time when I'm having a headache.
Sure.
But there's the cause of the headache that's not being addressed. So as a chiropractor, I address the cause to fix the problem. We adjust the patient, and that decreases about 80 to 90% of headaches on a regular occasion. So our number one success in our clinic is decreasing headaches. The second one is low back pain. Of course, a lot of people have low back pain. It's actually the number one problem out there right now is low back pain out of all the spinal areas. So we have seen miracles, or not say miracles, but amazing things that have happened in our clinic where people are barely walking into our office and they are able to walk out perfectly fine with no pain after one treatment.
Wow. And that's probably not the norm, though, one treatment.
No.
More like usually people will come in and go through a sequence with you. Wouldn't you agree?
They usually do about 12 to 24 visits depending on their issue. Consultation, examination, thorough x-rays, and then a report of findings will differentiate what the patient needs. And after we talk on their second visit, we discuss this is what's happening and why, and how we can address that issue. So yeah, number one, the visit for one treatment is usually not going to cure a problem, but sometimes that does happen.
Well, I know I mean, I've seen it with my own wife and the things that you've been able to do with her and adjusting her. And I will tell you, folks, this is something that is for real. Chiropractic medicine's been around for a lot longer than most of us knew, which surprised me. And one of the things that we want to do today is introduce somebody that's in the local area that's making a difference, most specifically in the scoliosis realm. And we'll show you more about exactly what's going on there and how you can make a real difference working with a chiropractor in your area like Dr. Spencer Shanley. And one last thing I want to make sure is people can get a hold of you at what's your number and
Well, our number for the Keller area in Dallas and Fort Worth is 817-605-9500.
Okay, so they've got that on the screen, and this is one of the things that we want to make sure that you know is that you've got a way to get a hold of Dr. Shanley. You can also visit him on his Facebook page and like it so that you can get updates on things that he's doing to make a difference in the community and in the Dallas-Fort Worth area. I've been really pleased and I'm thankful for not only knowing him but also being a part of what he's doing. So hang around. We'll be right back after we hear from our sponsors. And welcome back to the Business Spotlight. Today we're talking with Dr. Spencer Shanley in the Keller area. He's a chiropractor there that I've been using and my wife has too. And we've been really touched with his knowledge, specialty in these areas that make a difference with the spine. One of the things that we alluded to right before the break was the scoliosis and his work in that area that's making a difference in so many people's lives. So, Dr. Shanley, tell me about this scoliosis brace, I guess, that you guys are using and why you're using it. What's the story there?
Well, this is called a Scoli brace. It was established in Australia several years ago. The brace is designed to overcorrect the spine. So when you have scoliosis, your back is curving in either a C-shaped fashion or maybe an S-shaped fashion, and the curve is specifically corrected with a brace that's three-dimensionally analyzed by computer scanning. We do x-rays, posture analysis, and with all of this combined, we send it off to a lab, and this brace is designed specifically for the patient to correct those curves. So no one else can wear this brace except for that person. And they wear it 4 hours a day starting out, 5 hours the next day. They work their way up to 21 hours a day. After 1 month, we do x-rays to see how they're working with the brace and if it's actually affecting them. But this brace is specific to preventing surgery. It's specific to correcting and reversing for the first time. There's never been a brace that's ever really, truly corrected something potentially 100% like this brace. So it's pretty amazing.
So right there.
So this is called the Scoli brace once again. This is just a model, but there's 50 different colors that a patient can choose upon. So I like this one. It's like a marble color effect. Virtually invisible underneath your clothing. As you can see, this has different curves to it. If your back was to curve this way in your upper torso, and then as you go into your lumbar or lower back, it's curving into a C-shaped fashion. If you guys can see that here. If you were to curve this way, the brace is designed to push in that curve and straighten it out. And as you wear this 21 hours a day, it will eventually reform the spine without surgery. That's the key, is that you're going to be able to correct your spine and with virtually no pain, no metal, no scar down your spine with this brace.
That's excellent. What it sounds like is something that This will sound kind of a fun, interesting comparison, but in the dental field, there are things that are called Invisalign braces.
Exactly.
Basically, they do the same thing. They're semi-invisible to the view, and they'll adjust your teeth or your bones.
Right.
The way that does is what I'm hearing. Is that kind of what you're saying? Now, have you had any success with this? And what are some of the stories that you have there?
There's plenty of research out there. It's been in the New England Medical Journal. It's had years of results. In Dallas-Fort Worth, we are new with this technology. So it's brand new to the area. No one else has it except for myself. And we have amazing results already within 1.5 months of treating.
Now, when you say no one else has it, is that nationwide or just in the Dallas-Fort Worth area or within Texas itself?
There are doctors of chiropractic throughout the nation and throughout the world that have this technology, that are certified to do this brace. But in Texas, and specifically Dallas-Fort Worth, there's only 2, and I'm one of 2, and the only one in Dallas-Fort Worth that can provide this brace and have the technology of scanning and then sending off and then receiving, fitting the brace, and following up with the patient concerning this brace.
What kind of percentage of, if I could, of the people that are affected by scoliosis, is there a number for the number of people that are actually affected by that on some sort of, I don't know?
There is a large percent, more than you would think. At least 6 to 8% of the population has scoliosis.
Well, that's like a lot. I mean, that's
quite a bit.
18 million plus,
Right.
is what I just heard. Is that correct?
That's correct. There's a lot of people out there that have this. There's a lot of people that are suffering. They have no option. And this is now their way to correct it. That's a new option that they never had before.
Now, in the past, what they've done is what? They've just basically done surgery has been their only solution?
Either they live with it and suffer as it progresses. A lot of people are misunderstood with the idea that it stops after you stop growing. But you actually progress 1 degree every year as you age. So it's an osteoarthritic or a degenerative type of scoliosis that occurs. So that can be very painful. I actually have a patient that she had a compression fracture in her lower back because of the abnormal curves along with her age and osteoporosis. So it can not only pinch the nerves and cause damage to the nervous system, but it can cause degeneration and eventually possibly a compressed vertebrae.
And usually those operations cost a tremendous amount, right?
They're very expensive, yes. So this would save you money. Sometimes it depends on your insurance. You can have it covered by your insurance in different facilities. But the whole process of going through that, if not necessary, I would try to prevent that, because your children are your pride and your joy. Everything that you have done in your life is for your children. You love them very much. So if you had an option to where you could prevent them from any pain at all, just have minimal discomfort starting out, that is something that you would want to do. I know that you'd want to help your children without cutting, without metal in their spine, and the success rate of a patient the day after surgery with scoliosis surgery is being able to sit up for 5 minutes. So this is much better.
Excellent. Well, I will tell you that this is something that you should look at. If you have scoliosis, you know what we're talking about. After the break, we'll go farther into this subject. We'll be right back. Welcome back to the Business Spotlight. I'm Pat Dewar. We're having a great show today. I've got my good friend and my chiropractor, Dr. Spencer Shanley from the Keller area, talking to us today about several things that have to do with, well, pain, your pain specifically. If you've got headaches, if you've got migraines, if you have lower back pains, or more specifically, as we said in the last segment, if you know anybody that has scoliosis, a curvature of the spine, he's got a solution that isn't surgical, and it's a tool that has been very effective in saving so much pain from the people that he's been working with. In the Dallas-Fort Worth area and pretty much within the Texas region, he's your guy. if you want a solution for the scoliosis experience because of the brace that they have, the Scoli brace, right?
Correct.
Wouldn't you agree?
Yes.
So one of the things that I really want to get into today on this segment is, we've talked a little bit about this, the chiropractic services, but what are some of the real live experiences you guys have had, some stories of the clients and how you've been able to make a difference? Because, a lot of people just don't know anything about chiropractic medicine. They just don't know. But yet, you have seen so much, you've made a difference. How are you making a difference, and to who?
Well, that's a great question, and I've been very fortunate to see different people come in my office that have experienced great things happening. So the first story that comes to my mind is, just like I was mentioning about the Scoli brace earlier, that you're investing in your children, and if you can help your child prevent any pain at all, then that's what you want to do. And this is an option for us through chiropractic, is allowing the body to heal itself naturally without drugs or injections or surgery. So this chiropractic care is relieving pressure off of a nerve that's pinched, allowing the body to heal itself. And the first story that comes to my mind is a young boy that's about 12 years old that was suffering of severe migraines for 9 years.
Oh, wow.
He was on 6 types of medications that weren't truly helping, per se. You would rather do the medication than not, of course. But in this scenario, he was not able to play football because of his headaches. The helmet would hurt when he put it on. He couldn't study properly. He couldn't function as a child properly. It was affecting him on every avenue possible. He came into our office, and we discussed that if we could help him in this change, that she should remember this and share this with as many people as possible. But we can't always see what's going to happen, and we hope that things will happen and change, allowing the body to heal itself. So naturally, we go into this with high hopes. After one treatment, he felt a little bit better, a little bit less migraines, a little bit less headaches. After 2 treatments, just 2, and 9 years of suffering, he no longer has any migraines, any headaches. He's off of all 6 medications, and he's back playing sports and football again. So to me, that not only affected him now, but the rest of his life.
Sure.
And that is huge to us.
Yeah, well, I know the other thing that I'm curious about is, briefly, you've seen some pretty significant results even with the Scoli brace, haven't you?
I have one patient that recently was braced about a month and a half, 2 months ago, and as a lot of parents would say, it takes longer to really see the results of something like a brace, but this has been researched and proven throughout the world for numerous years. But with our office, as this is new technology in our office, we have a young boy that is 14 years old, has a 35-degree lower back curve.
Okay.
He recently, actually yesterday, came back into our office for a follow-up after being braced, and he now has an 11-degree curve in his lower back, or 69% improvement within 4 weeks or 1 month.
Wow.
So wearing the brace, we take an x-ray after 1 month to see if it's improved by at least 10%, so we have high hopes of the body changing and healing naturally with this brace. And this patient improved by 69%, or actually from a 35-degree curve to 11 degrees. It almost brought tears to our eyes as we were looking at this x-ray, and we know that he's going to have possibly 100% correction with this brace.
Wow. But the national average maybe, or the world average for this brace, is it 10% better, 15%? What are you seeing just as kind of anybody could experience some benefit if their body will adjust? Is that one of the key factors, is if their body will adjust?
Right, that's what the first month with the x-rays wearing the brace is for. We have them come back in to see if it's actually changing. If they're not changing after 1 month, then unfortunately the brace is not going to work. And that doesn't happen too often. We usually have results on 80 to 90% of patients. If there's a case where we know that it's just too far past the point of the bracing, maybe 50 to 60 degrees, sometimes you can have results, but a lot of times you advise the patient that it may not work due to previous experiences. But we do have a great impact and a great result on a lot of our clients that do brace. It can work for all ages, not to mention. It's better to start young because they're still changing and you can affect the growth of the bone. But this brace is good for adults too.
That's excellent. And they'll adjust it to this, in a sense, the size of the person. You don't have
Exactly.
to be a small person to actually use this.
No, it's specific to you. So you may be a small, thin individual, or you may be bulky or a little bit overweight. It's specific to each patient to help you.
Very good, very good. Well, like I say, I mean, we're talking with Dr. Spencer Shanley of the Keller area. He's a chiropractor. He's making a difference in that area, and I know he can make a difference in your life as well. Here on the Business Spotlight, one more section. We'll be right back. And welcome back to the Business Spotlight. I'm Pat Dewar. We're talking with Dr. Spencer Shanley, the chiropractor in the Keller area in the Texas region. One of the things that we're really thankful for is, we've been talking about how he's helping people get rid of things like migraine headaches, lower back pain, and even changing and helping someone that's afflicted with scoliosis, which is curvature of the spine. They use a certain brace that has had some great results, and even if you go back into the previous section of today's show, you'll hear the story of a young boy that was affected tremendously very quickly. Within a month, he was having some great results. Just a great result that we've been able to see. So, Dr. Shanley, how would someone get a hold of you and connect with you?
The best way possible is most likely the internet. So Googling Shanley Family Chiropractic or going to our website at shanleyfamilychiro.com.
Okay, they'll put that up on the screen. So,
Okay.
And then also you've got a good Facebook presence as well. So, like you on Facebook, right?
That's correct. You just look underneath facebook.com/Shanley Family Chiropractic.
Excellent. And then they can get your updates and things of that nature. I also know that we've talked about giving you a call. And if they give you a call, they want to set an appointment. And what's the usual process? How do you engage somebody?
If you call, we try to get you in the same day because we know that you've probably been waiting at least a few days or possibly months to come in. So we would like to try to get you in as soon as possible.
Yeah, because a lot of times people are hurting when they're calling, right?
Exactly, and that's the majority of people. The best time to come in is when you're not hurting. Just like when you're going to the dentist, you don't wait till your teeth are hurting or falling out. You don't wait till your back is out before you come to see me. You prevent the problem, and prevention is the key.
Yeah, but I know that, realistically, sure. People, they throw their back out and they're like, how do I fix this?
Yeah.
And so, they come in, you usually go through a process, right? When you're bringing on a client, if they, and whether you receive insurance and stuff, do you guys take insurance?
We take all insurances.
Okay.
The only one that we currently aren't taking is TRICARE, but we do have discounted rates for the military. We do respect the military, police, and fire department very much so, and actually provide that offer of discounted rates for them.
Yeah, and they're reasonable too. One of the things that I really appreciate about you is that your rates aren't so expensive that I couldn't afford you. They were reasonable. We could get together and create some solutions for my wife because I know she had some things, and me. I've had some curvature of my neck and
right.
and probably from driving too much or not having good enough posture.
Yes.
But if you were to sit there and say, give a couple of tips of what people can begin to do to maybe prep themselves to go in or stay away from you. I mean, goodness gracious, that may sound funny, but what can people do to help their spine?
Well, the first thing is our posture, and that's what I specialize in as a chiropractor. And I have additional education on top of that as a chiropractic biophysics physician of chiropractic is restoring curves and changing your posture. And it's more detrimental than we realize, but today our children are suffering, a lot of adults are suffering, and it's an epidemic that's going throughout our world and our nation as we have people looking down at laptops and iPads and cell phones, it's causing degeneration, premature arthritis, and collapsing of the cervical spine, leading to headaches, neck pain, upper back pain that is preventable. So this is the key. Is number one is changing your posture. When you're looking down at a cell phone, don't look down like this. Bring it up. Bring it up to your eye level, a laptop. Bring it up on top of a desk. Put a box or a frame of some sort underneath your computer screen to raise it eye level. Don't slouch. When you're watching television, sit up straight, keep your chest out and shoulders back with your head eye level with the television. If your TV is down low, try to raise that up also.
Excellent. You know, those are great tips. I mean, sometimes it's just that little bit of raise your phone up here. I noticed
Simple.
myself on the plane the other day, and I had to raise it up like this because it's so easy to have it down like that. So the fact is that if they're in the Texas region and they have a scoliosis issue, they should be calling you.
They should. There should be. We should be on their speed dial. We should be the first one that they think of, because we are the number one option for natural health care. We are the only option in the Dallas-Fort Worth area for 250 miles.
Wow.
I'm the only doctor certified to have this brace. And you need to try this first. You wouldn't want to jump into any other things that may end up possibly being necessary in the future. You want to try the brace first. If that doesn't work, then you move on to surgery. And surgery is sometimes necessary, and it's great. I'm all for these doctors that are changing lives with surgery. But if we can sometimes prevent that, I have a spinal surgeon that works just down the street from my office. They referred me a client. That 14-year-old boy was referred by a spinal surgeon because he knew there might be a possibility that we could correct it without surgery.
Excellent.
And he took money out of his own pocket to help a young boy. That's what I want to do. I do all that I can to help my patients, and I want to help yours. I want to help your children. If you're having scoliosis and you're dealing with it for years and you have not had an option, now you do.
That's excellent. And then also some of the other things that you typically see is lower back pain,
Right.
And headaches, but you said migraines. Somebody that has had migraines, that's something that is usually due to some sort of back.
It's usually the neck, the upper neck out of place. The forward head posture greatly strains the spinal cord, leading to irritation to the brain. It can decrease signals from the brain to the body, allowing irritation and inflammation of the spine. The other thing is the upper neck affecting the jaw. Like I discussed when I was younger, I had jaw problems. So we addressed TMJ. I have a patient with 20 years of pain. One adjustment, the jaw was now pain-free.
That's awesome. Well, folks, this is a Business Spotlight. I'm Pat Dewar. I've had Dr. Spencer Shanley. Thank you so much. He's a chiropractor in the Keller area that you need to visit. You can call him. Information was on the screen today. We'll talk to you next time.